recorded version after. Will we have the recorded version? No, not recorded.
Clicked on start. Let me put my computer on the table. Putting on slippers. I've done all of this before. Okay, Dr. Jide is live. Dr. Jide. Let me tell him he can speak. Dr. Jide.
Yeah.
Okay, you can speak. You're live.
Okay.
This is started because it was raining.
Hello, everyone, and thank you for joining us at first of our series of webinars. We appreciate your presence, and so for today, I would be hosting Dr. Lilian Ekpo to speak to us about today's topic. So a brief introduction on who Dr. Ekpo is. She's an executive director at Avon Medical Practice. In this role, she oversees the strategic, operational, and the administrative management of the organization to ensure that all its goals and objectives are effectively delivered. So Dr. Ekpo has a wealth of clinical and leadership experience. She holds a Bachelor of Medicine and Surgery degree from the University of Ibadan and a Master of Business Administration degree from the University of Warwick. Prior to becoming the medical director at Avon Medical Practice, a role that she has held for 7 years now, she also served as the head of clinical services at Marina Medical Services. So Dr. Ekpo is pretty much experienced and has a lot to say about today's topic. Welcome, Dr. Ekpo.
Thank you.
Dr. Ekpo, you are good to go.
Good morning. Good morning. Good morning, Dr. Jide. It's nice to be here. Thank you for having me.
Thank you for accepting the invitation. So, I think basically what we're going to talk about today is something that I would say is relatively new in the Nigerian health space, and that is telemedicine. And we just want to let people understand what telemedicine is, let them see the pros and possibly the cons of telemedicine, basically to have everybody familiarize themselves with what telemedicine is and how telemedicine, especially in the face of the current situation, how telemedicine can be used to our advantage in the space of healthcare delivery in Nigeria. So I would leave the floor open to you. I have some questions, but I mean, if you could maybe summarize and then get down to specific questions. And for those of us who are joining us, if you have any questions during the course of the webinar, please send via a chat and I will take your questions and pass them on to Dr. Ekpo as well. Thank you.
Okay, well, telemedicine is exactly what the definition describes. Um, it's a form of consultation where that is done via, screen. So you're either using some form of, for example, we're having this meeting and we're not present in the same location. So basically, if you were a patient and I were operating in my position as a doctor, we could have a consultation right here, right now. So that is basically what telemedicine is. So you're seeing someone, you're not, it's a virtual consultation. You're not seeing the patient physically, but you are having a discussion about the patient's symptoms, whatever complaints there are, and you come to a diagnosis via that medium, and medication, whatever treatment modality is prescribed via that medium. That's in short what it basically is.
Thank you. So maybe let me ask you some specific questions, and then as we go ahead, if there are other questions from the audience, then we'll take those as well. So currently, the world is battling the COVID-19 pandemic, and especially when there was a full lockdown, people had to rethink how they've had to do things. I mean, most of us started working remotely. A lot of people didn't step out of their houses for weeks. But during this time, people still had the need for healthcare access. So, in what ways have you seen healthcare organizations respond to the COVID-19 pandemic with innovative methods? So, for example, let's use Avon Medical Practice as a case in point. How did Avon Medical Practice react to in what ways were you able to still continue to provide access to your patients?
Well, yeah, I mean, we're here discussing it basically. The establishment of telemedicine, video consultation, virtual consultations, whatever terminology you want to use for it, was something that we had to very quickly implement. So we had, have a robust IT backbone that supports the hospital with our electronic medical records and all of that. So that had to be implemented. Of course, we had to let our patients know that this had been set up, and it was the preferable means of accessing care. So, for example, it's not every single condition that can be dealt with via telemedicine. Sometimes you actually do need to examine a patient. And if, for example, the patient needs surgery, you can have virtual surgery, at least for now. Technology doesn't allow that. You still need to be to operate on a patient. But for the most basic of things, and even a preliminary diagnosis, you can do that via virtual consultation or even via the telephone. If your patient is clear enough on how to engage, you are dealing with someone that is literate, that will understand you, and by saying literate, the person doesn't necessarily need to speak and communicate. So even if it's Yoruba, the person understands. The doctor is fluent in Yoruba, because there's no the limitation of sometimes a virtual consultation is that since you are not physically present, you have to rely on the other channels of communication. There's no gesticulation, there's no physical presence. I can't see the patient. If the patient is not telling me the truth, I can't exactly determine. But if the communication is clear from the beginning and the doctor and the patient understand each other, then you're able to get some good work done. And we've been able to achieve that. We're running virtual consultations now every single day.
Okay, thank you. So telemedicine, it's been around, I think from the late 90s or early 2000s, but in this part of the world, it hasn't really caught on. But in the last 3 months, again, since the pandemic started, adoption seems to have increased. Do you think that the COVID really played the pandemic played a specific role, or it was something that was still bound to happen eventually?
It probably would not, it would have happened eventually, but it would have taken a very, very long time in this part of the world. One, we're living in a developing country. Lots of people don't have access to data, the internet, and even when you do, the cost is expensive. So it wouldn't have been something that people would have readily embraced. For the fact that it does have its limitations is another challenge. The fact that, doctor is not examining me, he's not seeing me, Nigerians like what they can see, feel, and touch if they're going to spend money on it. So yes, it would have taken a while, but we've gotten here because COVID has forced us to think out of the box. We've had to find solutions and ways to engage and continue life and as normally as we possibly can. And the only way to do that was to have video consultation. So we got here really this quickly because of COVID. If COVID hadn't happened, we probably would have been having mainly physical consultations for, years to come. And in addition, aside from even just, patient acceptance, there's also doctor acceptance. Doctors can be very traditional, very rigid. This is the way I know how to practice medicine. This is the way medicine is done. So, it would have taken a lot to get people to just, run this virtual thing. But now, because you're really not sure who has what when you're seeing the patient, you're a lot happier and more comfortable doing it behind the comfort of a screen than seeing a physical patient who, heaven forbid, if right now the patient coughs on you, you'll almost throw a fit. So, the patient coughs through a screen, that's fine because you're safe behind your screen.
Right. So you mentioned something earlier. You talked about infrastructure gaps. So the cost of data, ability for people to even afford the data where it's available. And in some cases, issues with poor connection, poor internet services. So all those have a way of impacting the overall patient experience. I can imagine being a patient, I'm on a consultation with my doctor, and maybe because the internet service is bad, I keep having to repeat myself over and over and over and over again. How do you think doctors can, I know most of those factors are out of control of the doctors and the patients, but for doctors, how do you think they can help to sort of reduce the negative impact on the patient's experience?
Well, I think for us, what we've done is we've also included phone consultations. We had a number of people, the medium that we use to run the telemedicine platform is based on Microsoft Teams. When we initially rolled it out, we had a number of people who would say, oh, I don't have Teams, why do I need to access it with something I need to download on my phone? Can't I just reach you in any other way? So, if you really, if the aim is to improve and broaden access to healthcare, then you can have something that is streamlined and can only be accessed by a couple of people. So we have a robust intercom system, and patients can actually call in. We have 2 dedicated lines that can, you can call in and ask to speak with the doctor. And, the doctor can have its own consultation. Again, just like for video, there are limitations of that. But the essence of this entire thing is to ensure that the patient is as honest as possible in the engagement. So you're not saying symptoms that are not, you're not withholding anything, because so if a patient withholds in a physical consultation, by the time I examine you, I can find out, sorry, madam, this swelling that you say came yesterday, it can't be yesterday. The way it looks and how it looks, you're not telling me the truth, so tell me the truth. Aha. But if you have video and if you have phone, then you are entirely dependent on what the patient is saying. So we've been able to, try and engage and overcome those challenges by finding different ways of which can engage the patient, both video, both phone, so that we can really deliver the kind of care that we want. And I think in the end, for people that, not critically ill people, critically ill people definitely should be in hospital, but people with basic illnesses, we've been able to accomplish that.
Okay. So for healthcare providers who may be considering deploying telemedicine services, from your experience, what are the most important things for them to consider? What kind of infrastructure would they need to put in place, processes, based on your experience with the implementation of the same thing with Avon Medical Practice?
Well, clearly you need to have a strong IT backbone. If you don't have a very good IT structure, you can't run telemedicine consultations or even phone consultations. It will be easier to run, not impossible, but a lot easier if you have electronic medical records, so that as video consultations are ongoing, you have your electronic medical records popping up, and the doctor can actually read through the patient notes and understand, marry the patient's presenting complaints with, the patient's history. So that is key. The IT backbone and infrastructure is key for that to run. You also need a good legal structure, because since we started conversing, I've mentioned it over and over again that there is a limit to telemedicine. You are relying entirely on what the patient is saying. So if the patient says, my blood pressure, for example, a diabetic patient whose blood sugar has been out of control, and says, oh, doctor, don't worry, my blood sugar is fine. I checked it this morning and it was normal, and that patient is lying. I am relying on what the patient is saying. So you must have your legal team prepare those fine prints that says this consultation is based entirely on you telling us what is accurate, giving us accurate information. If you don't give us accurate information, then we are not liable for whatever happens, because there's always the likelihood of litigation and mismanagement, the diagnosis was wrong and all of that, but we can only rely on what you're given, and the patient needs to know that. So those two things, IT and legal, I think are the things you really need to work on.
Right. What about staff training? Like you said, doctors are very traditional people.
Yes. Well, staff training is not, because it's really very basic. Look at how the entire world has just transited to Zoom. My son runs his lessons on Zoom. He's 10. I think he's probably better at Zoom than I am, because he shares his screen, he does everything, he knows where to write notes and chats and things like that. So if a 10-year-old can do it, and that was with minimal, I think there was just one day where he struggled a bit to find out how to share his screen, how to comment on his teacher's notes and things like that. But since then I haven't had to help him. So if a 10-year-old can figure it out, there's not much training that the doctor really needs to be able to figure out how to run a virtual consultation. The key thing there is clinical skill. So being able to decipher, because you have a lot less to go on. The training we are taught in medicine is, IPPA, inspection, percussion, auscultation. So the whole bulk of physical examination is a significant part of coming to a diagnosis. So you need to have very good clinical skills to be able to just listen to a patient and be able to figure out what is wrong. And also not just figure out what is wrong, but get to the point where you are saying, I'm sorry, I don't think this should end in a virtual consultation. You need to come into hospital, I need to see you. It is someone with good clinical skills that can discern what can end at the virtual consultation and what cannot.
Okay, so what about quality assurance? So another concern people might have Like you said earlier, Nigerians prefer the one-on-one, face-to-face conversations with doctors. Yorubas have a saying where, literally translated, the conversation is in the eyes, is in the face. So people are more comfortable with being physically present with whoever they are speaking with. So a concern for some people might be, oh, how am I sure that what the doctor is telling me is actually appropriate? And then from also speaking as a doctor, you also want to be, there's also the concern that for the doctor who's consulting, where does the doctor draw the line in terms of determining that this is something the patient actually needs to come into the hospital for, or this is something that can still be managed remotely? So how does Avon Medical Practice ensure the quality assurance of that whole end-to-end process, from consultation to determining the outcome, the appropriate outcome for that consultation?
Well, like I said, it basically is dependent on the skill of who is engaging. And we have a very rigorous recruitment process. So from the point where we decide that we are going to be hired as a doctor in Avon, even with the locum consultants, there's a very rigorous process in engagement of doctors. So that for one shows that, helps to already, should I say, take out the concern of, are we sure who is seeing who? What is the quality of engagement that is happening with the patient? Because like I said, it is someone that is skilled that can say, from listening to the patient, even if a patient lies, if a patient says, for example, my blood sugar has been fine all through, but she's telling you, I was feeling very weak and sweaty, and I had, there was a time I felt like passing out and my head was pounding. That doesn't seem to tally. That sounds like that patient's having hypoglycemic spells, and yet the patient is telling you their blood sugar is fine. So, there are just some things that come with experience and a significant amount of clinical skill that you can determine and decipher and say, no, you can't be telling me the truth. Well, of course, you won't say it to the patient in that way because you get their backup. But it may just be, oh, I think it's better for me to see you physically so that we can sort things out. And then maybe when, for example, if it's a diabetic patient, you could actually come in and do a blood sugar on your own and find out whether the patient is well controlled or not. So it's really down to the skill of the doctors we have. And for that reason, the consults, since we started, we haven't had any issues. We've had people who would, by the time you engage, you just decide, the doctor decides this patient actually does need to come in. Sometimes it's not even because you may need to run tests. We can't run tests virtually. So I'm seeing you, I think the diagnosis is this, but I need to, be absolutely sure. I need some blood work done. So can you come into hospital? So, as I say, it's really down to the skill of the doctors, and we have that covered from our recruitment process.
That's good to know. So in terms of costs, when you read about telemedicine generally, part of what is said as one of the advantages of telemedicine is that both on the patient side, especially for the patient, there's a reduction in cost. So cost of transportation, especially for patients who live in remote areas, are trying to access quality care, and things like that. But when you put it in context, in the Nigerian context, especially considering the economic situation in Nigeria, for both the patient and for the healthcare provider who has to invest some money into setting up for telemedicine to take place, how expensive is this, both for the patient who has to either pay for data, or even where there's a telephone consult, has to spend airtime? How expensive is this? And then from Avon Medical Practice's perspective, how do you try, maybe with internal processes or SOPs, to reduce the cost burden on your patients?
Okay, so I'll borrow a line from the pharmacists or the pharmaceutical industry. When they bring out some products and you say, oh, well, how much does this cost? And they mention a price. And we say, oh, that seems to cost a lot. Then they say, oh, it's not costly, it's cost effective. So I will borrow their line and say it's cost effective. And by that, I mean to say that the world is moving towards efficiency. So it's not, we say, work smart and not necessarily work hard. Why? I mean, Lagos traffic is crazy. It's been raining non-stop in the last 3-4 days. So to get from point A to point B will most likely take you 3 hours. If you've got a straightforward cold, why would you want to get, and this is short distances that take hours to get to. So if you've got a simple cold, you've got malaria, you've got, I mean, what maybe looks like a boil, why do you want to get into your car, drive all the way, get stuck in traffic, get yelled at, you know, by some other driver just to, you know, because you feel maybe it might be cheaper, or you're going to spend your airtime or spend your data, you know, to see the doctor. So in that wise, it's saving you, because time is money. And that is one thing I think the developing world fails to realize, that time is currency. So if you're wasting time, you're wasting money. So it's not about, oh, it is cheaper if I go into hospital, or my 500 naira data is going to waste if I have a video consultation with Avon. It is, what can I achieve in that time? And if, for example, if you look at transportation, it's more expensive to go by air to Abuja than by road, but you save time. You can get to Abuja in an hour, and what you do with the rest of your time. But if you're going by road, it's a lot cheaper, but you spend the whole day. So it's those balances and deciding to be more effective as a whole, you know, as a people, that helps. For the hospital, you actually become, again, I mentioned efficiency and effectiveness, because really that's what it's about. So you lots of times OPD is clogged with people that do not need to be there. The people that have got colds, they stub their toe, they have a boil, they've just got a sore throat, and then your OPD and they're waiting forever because you've got people that are really ill. There's the heart attack that's coming, there's the RTA, and you know, and those people that are waiting for the simple coughs and colds, you know, they get upset, and those are the people that really give you the customer issues, you know, service issues. Because by the time you triage them, they fall to the bottom of the barrel, and you know, you're dealing with the emergencies first. So if you can get all these people out of your OPD, then you have time to concentrate and, you know, deliver efficient care to the people that need it the most. Those people that have malaria and the basic things don't necessarily need to come to hospital. It's more convenient for you to sit in the comfort of your office and just say, oh, doctor, I have a sore throat, you know, for how long? The last 3 days, when I swallow is a bit painful, you know, and all of that. I don't have a temperature, but my throat hurts. And he says, oh, go take, you know, whatever it is, lozenges for 3 days and you'll be fine. That's better for the patient and the doctor. So in the end, it saves money on both sides.
Both sides. Okay, thank you, Dr. Ekpo. So for those who are just joining us, thank you for tuning in. And in case you've missed the earlier parts of the chat, I'm speaking with Dr. Lilian Ekpo, who is an executive director at Avon Medical Practice. She has years of clinical experience as well as administrative and operational experience in leading the Avon Medical team. So thank you again for joining us. Dr. Ekpo, another, should I say, reservation that people have is the security of their medical information. You know, if I'm sitting my information into a case note, a physical case file, or typing it into, for hospitals that use electronic medical records, I can actually see the flow of transfer of my information from the doctor's consulting room to the lab, to the pharmacy, and I can see. but I'm sitting on the other end of a telephone line, and I'm wondering, are these guys using my information appropriately? You know, so is Avon Medical Practice compliant with the data privacy laws and things like that? Are those things that providers that want to implement a telemedicine model in addition to their practice need to consider when setting up?
Yes, so like I said, for you to set up, you need a strong IT backbone. And I said the best scenario would be for you to have electronic medical records. So all conversations are recorded for quality control purposes, and but the documentation of the engagement with the patient is actually done on electronic medical records. So as the doctor clicks on your the consult and the video starts, he's got your notes open. So whatever conversation you have with him, and it states there that this was a video consultation or a phone consultation. So if someone is looking down 3-4 years, I'm looking back 3-4 years down the line, they know, okay, there was no physical examination because this was virtual. It's not going to look odd that, oh, how come this patient was seen and there was no examination? It will be clear that this was either video or this was a phone call. And all of that is documented in the electronic medical records. And of course, I mean, in other parts of the world, even in places like the UK and the US, we've had patients' data compromised. So, I mean, that can happen anywhere, but whether your data is safe or not is dependent on putting proper data protection laws in place, which we ensure consistently that we have a robust system that protects patient data in Avon. So whatever information is passed on during either a video consultation or a phone consultation is definitely secure.
Right, thank you very much. For those who are watching, if you have any questions, please feel free to type in your questions and send, and then I would ask the questions, ask Dr. Lilian the questions. So another question, Dr. Ekpo. Avon Medical Practice, I'm sure you work with various HMOs. Now, the question is it only private patients that are eligible for the telemedicine service, or is it open to everyone, whether you have a HMO card or you are a private fee-paying patient?
Oh, it's open to everyone. Everyone from anywhere at all can access telemedicine services with Avon. It's not just HMO patients. Anyone that's willing to logs on, fills in that form, can see a doctor.
Okay.
Just like with the physical consultation, anybody can walk in and say, I want to see a doctor. So same.
All right. Thank you. From Avon Medical Practice's perspective now, based on, and you've been running this now for about 3 months. So from your perspective, how beneficial is the inclusion of telemedicine into your organization's processes? How beneficial has that been to you from, you mentioned efficiency, from an efficiency viewpoint, from a cost containment viewpoint? Generally, what has the experience been like for Avon Medical Practice?
Well, I'll first of all talk about the facts. I mean, the elephant, well, I can't even call it the elephant in the room, because the elephant in the room implies something we're trying to ignore. It's right in the front of us, and that's how it has helped deal with COVID. Because the default thing that we want patients to do is to notify us that they're coming, so that we can prepare. It's not every center that is equipped to treat COVID or handle, that has isolation facilities, special rooms and things like that. So it has helped by letting us know who is coming and what we think you have. And then we can engage with you and decide, okay, fine, you're good to go, please come in, or, you need to see, maybe call the NCDC if you're unwell, or we think you have COVID, or stuff like that. So that's the first obvious benefit right in the middle of this pandemic. But like I said, it's also helped reduce the OPD traffic, and unnecessary OPD traffic at that. So all the people that don't need to come in, don't come in. So if you just have a cold, malaria, those really basic things, and interestingly, that's half of what takes up OPD consultations. It's the really basic things. People, yes, I mean, we know that our healthcare indices in this country are poor, but a lot of the illnesses we have are really big. It's not everybody that has a brain tumor. It's not everybody that's going to need open heart surgery. Lots of people just have really basic stuff. And if we can help those people that have the really basic stuff and stop them from clogging up OPD, then we've been able to do that with telemedicine. So that's how it helps us. So I think from an efficiency point of view, the staff are not unnecessary, because sometimes you can really get run off your feet in OPD. So you're able to, like I say, direct your energies elsewhere and focus on the really critical cases and improve the quality of care that's been given to those people. So all around, it's really helped.
Great. Thank you for that. Again, for those who have questions, please type in your questions and send, so that Dr. Ekpo can share from her wealth of experience on the topic. Right, so in terms of, I'd say, the future of healthcare in Nigeria, like you said, we sort of had an accelerated growth phase in the last few months because of the pandemic in terms of adoption. Do you think that if the government issues an all clear tomorrow about COVID-19, we would revert to the traditional way of doing things? Or do you think that telemedicine will stay and remain something that uptake will continue to improve?
Yeah, I think it will stay. I mean, it's just like now, the term that's being bandied about everywhere is the new normal. So there's some things that even when all of this ends will remain. I find it very helpful, very informative that now we have webinars, international webinars. So you're seeing a webinar organized by Sanofi, and you have people from all over the world, from France, from Britain. Before, if the webinar organized by Sanofi, you'd only find Nigerians, because it would cost too much to bring all these people in to come and educate us. So there's a lot of collaboration going on because of what has happened. So definitely, even when the pandemic is over, this is here to stay. The people that, I mean, the executives in their offices that didn't want to come out before, and all the Nigerians that would just call their, friend down the road and say, oh, there's someone who's a doctor, please, I have XYZ. Now you can get a proper consultation for that, because we were doing these things before. Those are in quotes, those were telephone consultations, but they were in an informal setting. Now you have the opportunity to formalize that engagement. And so I don't think it's going to stop. I think why I mentioned the business of the seminars is that I think there'll even be more collaborations going forward. So you don't even, now we're thinking telemedicine is just the patient within Lagos, calling into Avon Medical. You can have somebody that's in Kano that calls Avon Medical and says, because really it's telemedicine, you can call in from anywhere. So, and call in and say, oh, these are my complaints, blah, 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 and we advise. So I definitely think that this is something that is here to stay, and the uptake can only get greater even when the pandemic is over.
Thank you, Dr. Ekpo. It's interesting, like you said, the new normal, quite a number of things are going to, I keep saying that as well, that we need to get used to the new way of doing things, because quite a number of things will not change, no matter how soon the government, the WHO issues are all clear. So people will only have to continue to adapt. Again, for those who have joined us, speaking to Dr. Lilian Ekpo, Executive Director at Avon Medical Practice, with years of extensive experience, both in clinical and administrative functions. And she's been talking to us about her experience with telemedicine and how it has shaped the way Avon Medical Practice currently operates and the advantages as well to them as an organization. So if you have, you can share questions via social media. I hear that we're having issues with the message icon. So at Avon HMO on Twitter, on Instagram, you can share your questions there, and then we will try to bring those questions to bear here. Trying to see if there are any messages for me, sorry. So please, again, follow at Avon HMO, Twitter, Instagram. We're waiting for your questions about telemedicine, so we can answer as many questions as possible. Dr. Ekpo is willing to share her time with us today. I think another question that I can think of right now that some people might want to ask is, you know, there's this conception people have. In the course of business, you talk to people who want to see only specialists when they come into the hospital. I still spoke to somebody a couple of days ago, and she said, "Oh, I don't want to see the young doctors, the specialists." So how do you overcome such barriers when people calling for telemedicine, and maybe when they even come in physically for, if they've had to be referred in to come in for physical visits?
Okay, so one of the things that I'm passionate about is health education, getting people to really understand things about their health conditions, and basically how a health system works. So coming in directly to request to see a specialist is not how a health system works. And that's why health systems are structured as primary, secondary, and tertiary care. So you must go through a funnel where we actually determine where you are to go. And when patients have this kind of thinking, it's always very important for you to disabuse them of, you know, those kind of thoughts, because sometimes they come in and they want to say wrong kind of specialty because they've gotten their diagnosis wrong. So if you see a GP, the GP then decides, this is what we think is wrong with you, and this is a specialist we think needs to see you. I mean, there's a lot of confusion, for example, between neurology and neurosurgery. But by the time you see the patient, you take history, then you say, sorry, you don't need to see a surgeon. Nobody's doing surgery on you. This is a neurological condition. You need to see a physician, you need to see a neurologist. But someone who's not a medical person doesn't understand that. Nigerians also, as I say, because that's why I say health education is one of my passions, Nigerians also are actually, even very educated people, are very illiterate regarding health. So there's this general conception that the older a doctor is, the better he is. But you must understand, a specialist just knows a lot about one thing. He doesn't know a lot about everything. So if you're going to see a hematologist when you have a hernia, it makes no sense. You know, but Nigerians will feel the hematologist has gray hair, so he's seen a lot of patients, he can treat me. And that's, some doctors who are charlatans take advantage of that, and they try to do, if you permit my vernacular, this gbogbo niche thing. I will do every operation, I'll see every patient. It's actually a load of rubbish. So patients need to be educated. When they come in, if it's virtual, physical, we let them understand the way the system works. Because for you to have order and services effectively delivered, the system should run effectively.
Okay, so I have a question. It's something that you touched on before, but for the benefit of those just joining. The question is, to what extent is telemedicine advisable, considering that sometimes there's a need for a doctor to see the patient physically and have a number of physical checks done, like checking the temperature, checking the eyes, observing the body language, etc.
So yes, like I did say, telemedicine has its limitations, and those limitations, I mean, should be, I think I've tried to clarify them in this discussion, but it does have its benefits. So for example, if I have a stable diabetic, it also helps, as I say, as I've said, one of my passions is health education. It would also, telemedicine will go a long way when patients are more informed about their health. So for example, if I have a known hypertensive and diabetic who I can have an informed discussion with and who tells me, oh, doctor, my blood sugar readings, fasting the whole of this week have been within normal limits. I've done my blood pressure at home. It's been fine. Then why do I need you to come in? All I need to say, okay, you look good. Continue your insulin, continue your medication at so and so dose. Or if you're telling me some readings that look off, then I think you need to come in. So it's, as I say, weeds out the people that do not need to come in. Because we must realize that everywhere in the world, healthcare systems are overwhelmed, aside from the pandemic. The pandemic is, I mean, these are unprecedented times. But you have a doctor, I think that the standard ratio for doctor to patient, is it 1 in 10 or 1 in 100? I can't remember, forgive me, so that I'm not quoting the wrong figures. But in Nigeria, doctor to patient ratios are abysmal. So we have to understand, if you really don't need to come in to physically see a doctor, then you are helping to improve the system, because he's not having an unnecessary consultation. If he can talk to you in 5 minutes and sort out what is wrong with you, then that's fine. People also need to be more informed and give the doctor, you speak to some patients and have no idea the medication they're on. And they've been hypertensive or diabetic, or they've got this medical condition that they've had for years. And you say, what are you on? I don't know. What's the dose? Doctor, I don't know. Is my doctor that knows? Check my case notes. And so you can't do that. You've had the condition for 10 years. You should know what you are on. So if people take ownership of their health, then telemedicine will work a lot more effectively.
Okay, so essentially, telemedicine is reliant on the on how what's the word now? On how well the patient can pass on and how accurate the information the patient is providing to the doctor. So
exactly.
What we can say then is that the patient is actually the one in charge in terms of information management in a telemedicine consultation. So the patient needs to own the responsibility of providing accurate information to
Correct.
the doctor in order to get the best out of that consultation.
Correct.
So I like the fact that, yes, it does give the patient some, should I say, power, in quotes.
Yes.
In that interaction, yes. So the patient takes charge. That's it. That's good.
That's
right.
Really the whole point of medicine, actually. It's gone are the days where it's just the doctor that sits like a demigod and is dictating what healthcare should be. Now it's patient-centered care. So the power is back in the patient's hands. The patient needs to take ownership, whatever, if it's a chronic medical condition, this is it, this is what I have, this is what I'm taking, this is what I need to do to stay, healthy, and own that, whole process, and not just dump it in the lap of a healthcare provider.
Okay. So another question is, I think for some people who didn't come in at the beginning, so we might have a few questions around things that you have already discussed before. There's a question here now in terms of trust. Why should a patient trust a physician that they can't physically see? You know, so I pick up the phone, I call Avon Medical. How am I sure that the person talking to me is the appropriate person I should talk to? Why should I trust that situation?
I don't think trust is necessarily based on, I mean, physical presence. Yes, physical presence has something to do with it, but I don't think that's the entire basis of trust. For example, if you come into a hospital and I claim to be the consultant neurosurgeon, how do you know I'm not? You don't know. I can have a consultation with you and tell you complete rubbish. So you believe me because I say I am who I say I am. And because medicine is a profession that works with a code of honor, and that is the same code that hospitals run by. The entire healthcare enterprise is run on the code of honor. So if you're engaging with a healthcare provider, you can be sure that, I mean, they say this is who this person is, then that is who this person is. Interestingly, Nigerians in our healthcare seeking behavior seek healthcare services from all kinds of dubious people. We go to pharmacies, roadside chemists, and we don't even know who these people are. We don't know what their credentials are. We don't know what they can do, but people go to them. So if you have no trouble just walking up to some strange pharmacist who you've never seen his degree, you don't know if he's a pharmacist, he may just be a patent medicine seller or some apprentice who's working with someone, and you're willing to say, oh, but if they pay me, mix medicine for me, and you take it, then why should you have a problem picking up the phone and trusting that the person that's speaking to you is who they say they are?
Right. So patients just need to trust the healthcare provider to provide, I mean, especially if it's a provider that you've been using before. You just have to trust the provider to be sure that they are providing you with the best care.
Yes. And of course, if it's a provider you've been using before, then, I mean, there might be people you know. So it's not like you're seeing, if it's a video consultation, it's the same doctor you would have seen physically that you are seeing just via video. There's no difference.
Right. So another question, this is from Twitter this time. Some HMOs insist that malaria sepsis investigations have to be carried out before treatment, or your claims will be denied. What can providers do to discourage this, since telemedicine is now the way to go? Especially since, Dr. Ekpo, you said earlier that it's not possible, at least not yet, for us to carry out blood work on patients remotely. So what can providers do to discourage this insistence by HMOs that those tests must be done before the diagnosis or the treatment of malaria or sepsis can be carried out?
Well, that's in a sense a multifaceted question. So, and I will probably be seeming to speak from both sides of my mouth. And by that, I mean, I will speak on the side of the HMO and side of the healthcare provider. Now, for you to make a diagnosis of sepsis, you must have an altered full blood count result. You cannot conclude that the patient is septic if you've not done blood work. Now, malaria, on the other hand, a number of times is a very strange disease to treat. And by that, I mean, you could do an MP. We live in a malaria endemic zone. So as I speak to you, I feel absolutely fine. But if you were to take my blood, you might find MP positive. Now, I am not unwell. I do not need to be treated. So that test alone is misleading. So I do not agree with the fact that you need to have a malaria parasite test before you say a patient has malaria. That being said, I know where that came from. That came from every Tom, Dick, and Harry saying, I have a headache, I have, body pain, I think I have malaria, and they're taking malaria medication when they actually don't need it. If you sit in Lagos traffic long enough, you will think you have malaria. So, so yeah, so there are lots of things, and we seem to forget, except now I think it's been brought to the fore because of COVID, that viral infections do exist. Some people get very nasty colds where you have a headache, you have body pain, you have a temperature, and it feels, it seems like malaria. A lot of people would say, oh, I think this is how my malaria starts, and they go treat themselves. So I forget which entity, whether it was WHO or some, healthcare governing body that said, don't treat malaria until you have a test. But the test is misleading. So for a lot of people, sometimes when I say to the patient, a patient comes to me and they, present with all the symptoms, I say, look, I have found that for most people, if you are not extremely unwell, so you don't have a fever, your joints are not aching badly, you do that test, it will be negative. But that doesn't mean you don't have malaria. If you leave that patient alone and give the patient 1 week to get really febrile and really unwell, you do the test will be positive. But that patient has suffered being unwell for a week. So when I see patients, I tell them this. And this is, if they're not HM1, there's not going to be some, trouble at the back end regarding payment, that I'm going to do this test. Even if it comes up negative, I will still treat you because I think you have malaria. So the only thing that is a clear indicator, or let me not say the only thing, but what is a better indicator of whether a patient has malaria is the blood film for malaria parasites, where you actually see the malaria parasite, malaria parasites on the microscope. But that is not an effective way to run because it takes expertise. It's too costly. We can't do it for. Malaria is a commonest presentation in OPD. If we were to run a blood film for MP for everybody, the waiting time would be, in fact, off the charts. So it's not practicable. So I don't agree with the insistence of malaria parasite testing before malaria can be treated. But for sepsis, yes, you do need to have a full blood count result before you conclude your patient is septic, because fever and body pain does not necessarily mean sepsis. It could be anything. You need to find out what exactly it is before you decide you're going to start giving antibiotics.
Thank you. So another question, and this is quite a lengthy one. So it says, just recently, the US government adjusted its health insurance accountability laws to accommodate telemedicine and make it easier for doctors to provide medical care remotely in the wake of the pandemic. Similarly, not too long ago, the Australian government announced a medical relief fund that includes an item for telehealth consultation insurance. What is the Nigerian government doing about telemedicine?
Well, the challenge is our regulatory environment in Nigeria is very poor. And it's as I continue to practice that I realize that I tell people a lot of times we are not underdeveloped because we don't have good roads and we don't have hospitals and all those fancy things. We're underdeveloped because a lot of structures are not in place. Regulatory structures, legal structures are just archaic. There are laws that haven't been revisited for maybe since 1960, 1970. So the government, in this country is not doing much regarding health. They just cut the healthcare budget right in the middle of a pandemic. So they're not, I don't think the Nigerian government right now is focusing on telemedicine or trying to regulate it in any way. But it is, I mean, it is ongoing as we speak. So, I mean, that speaks for itself.
So we hope that sometime in the nearest future, the government will do something about it. Okay, so again, thank you everyone for joining. We've been talking to Dr. Lilian Ekpo, who's an executive director at Avon Medical Practice. She shared from her wealth of experience about telemedicine, the use of telemedicine, and advantages of telemedicine to both the patients as well as to the healthcare providers. So we'll round up now. Dr. Ekpo, can we have like your final statement so that everybody can hear from you?
Yeah, so I will say that telemedicine is here to stay. I think patients need to, like I said before, take ownership of their health. I think a lot of times, as much as we've had healthcare providers that were a bit dodgy in the way and manner in which they delivered service, but a lot of things is actually dumped in the lap of the healthcare provider. You need to know your rights as a patient. You need to know, I mean, if you have a medical condition, you should know what medication you're on. You should know what some people don't know. They tell you I'm just allergic to something. They don't know the names of the drugs they're allergic to. Be aware. So I think that's really my message. Be aware, because it's patient awareness and education that will help telemedicine. So when we're seeing you, that phone consult, that video consultation, we're getting the right information. We're not getting led down a rabbit hole and the whole diagnosis is just rubbish, because I mean the information that the doctor receives makes no sense. So patient awareness, patient education is key. Everybody, please get informed.
Right. Thank you, Dr. Ekpo. And to those joining us, to those who have joined us for this webinar session, we say thank you very much. To reiterate what Dr. Ekpo said, for the telemedicine consultation, patient awareness, patient education is very key. And that is one of the reasons why Avon HMO decided to have a webinar on that topic. We would also continue to push out more information about telemedicine, the advantages, how you can access telemedicine services using our social media handles. So Facebook, Instagram, Twitter, we have at Avon HMO. Give us a follow. If you have questions, again, regarding the topic or other topics, you can drop those questions with the social media handles and they will be answered. Thank you very much, Dr. Ekpo. It was very, very educative speaking with you and learning from your experience. And thank you again to everyone who joined us for the session. Enjoy the rest of your day. Thank you very much. Thank you. Bye-bye.
Bye.
Bye-bye.